Hi everyone, my name is Louise Bula and I'm a UK Registered Dietitian. I specialise in diabetes and weight management. exante have asked me to come in here and chat to you all as it's Diabetes Week. So I have my mug of tea ready and I'm all set. So for those who may not know, type 2 diabetes is a chronic condition where your pancreas either doesn't release enough insulin or the insulin that it's releasing just doesn't work properly. And this is also known as insulin resistance. Although we don't know the cause of type 2 diabetes, we do know that there are a number of lifestyle-related factors that increase your risk of developing it. One of these factors includes being either overweight or obese. The most recent nutritional guidelines published by Diabetes UK have recommended that reducing energy intake to achieve weight loss should be the main focus when you're looking to improve your diabetes management and health overall. You can't cure diabetes, unfortunately, but you can certainly put it into remission, which means when you achieve a normal blood sugar reading without any diabetic medications. For type 2 diabetes remission, it's suggested that you must aim for a weight loss of at least 15 kilograms as soon as you're diagnosed. If that does seem like a lot, that's fine. You can also aim to lose 5% of your initial body weight, as that can help to improve your blood sugar control, reduce your cholesterol, and minimize your risk of other conditions, including heart disease. There's also been a lot of ongoing research to try and find the most effective strategy for weight loss. This includes low-fat diets, low-carbohydrate diets, very low-calorie diets, and total diet replacements. At present, there is not enough research to conclude that one of these is superior above the other, so it's just all about choosing the one that you think will suit you best. A very low-calorie diet is when you consume less than 800 calories a day, and studies have shown that this can be an effective way to lose weight. So at exante, for example, you've got your exante 800 calorie plan. The clinical guidelines that we follow, called NICE, suggest that these diets should be used for no more than 12 weeks continuously or as part of a weight management strategy with clinical support because of how restrictive they are in nature. There's also a good amount of evidence to show that using meal replacements can be beneficial to promote weight loss in people with type 2 diabetes. You can choose to either replace one or all your meals with one of your exante shakes, soups, bars, or even pot meals. The amount of calories that you should be aiming for in a day is anywhere between 800 to 1200 calories. And this will help to create a calorie deficit, which means consuming less calories than what you burn in a day. One study also did show that almost half the amount of participants who did this managed to lose weight and put their diabetes into remission, which is obviously amazing. The important thing to remember when following a dietary plan like this is that you don't want to be following it for a long period of time. So once you achieve your weight loss goal, you want to be transitioning back to a healthy, balanced diet to help maintain your weight loss and also essentially boost your health. If you do really enjoy your shakes and other products in exante, you can always use it as a substitute occasionally if you find that you might be returning back to old habits where you may be skipping meals again or not choosing the right foods. When you're following a low-calorie diet, using food or meal replacements, it's also important to be aware of a few things initially. You might experience some side effects, which includes constipation, dizziness, or even headaches. These should go away after a while, but if you suffer from any of these, it's important that you do talk to your doctor. Also, please do stay hydrated because drinking plenty of water can help to alleviate some of these symptoms. If you're also on any medications for your diabetes, including insulin or sulfonylurea tablets, being on a low-calorie diet can increase the likelihood of having more hypos. So that is when your blood sugars go down below a range of approximately 4 millimoles per litre. If you also take medication for high blood pressure, you're also at risk. So if you can relate to any of these, please do seek medical support because it's important that you get the right support from a nurse, a doctor, and also a specialist dietitian. We are here to support you at the end of the day. If you have type 2 diabetes and you're not taking any medication, then it's very unlikely that you will have any low blood sugar levels. In terms of which exante plan to follow, You could choose the type 2 diabetes one, which is the very low calorie diet. And you can essentially start off at 1200 calories. And then if it seems like you're not losing too much weight, then I would probably say to gradually cut the calories down. But also remember that you want to focus on losing anywhere between half a kilo to a kilogram a week and no more. Because the chances are if you're losing more than that, it's mainly not fat. And obviously we want to try and conserve as much muscle, especially in your body. So when we also think about people with type 1 diabetes, I wouldn't say that exante is not for you, but it is important that you feel confident enough to adjust your insulin to your to whatever, for example, whatever exante product you choose. And if not, I would always say seek support from a registered dietitian so that you can ensure that you're doing the plan as safely as possible. There's also certain circumstances where you may experience weight loss, which is quite slow, I'll say, especially women that have hormonal changes during the menopause or even with polycystic ovarian syndrome. I would certainly say that it's not impossible for you all to lose weight, but it does make it slightly challenging. So as long as you're ensuring that you are in a calorie deficit, you're exercising enough, so roughly 30 minutes of activity, about maybe 4 or 5 times a week, then you will notice weight loss slowly but surely. I do always speak to my weight loss patients when I say, you know, it's important that you understand that it is a journey at the end of the day, and there's certainly no quick fixes. It's also important, another wee tip, when you are weighing yourself, to remember that the amount of fat, that number doesn't represent the amount of fat in your body. It represents the weight of your muscles, your organs, water also, as 60% of our bodies are water. So although the amount that you're losing every week might seem minimal, it is enough and you're doing a fantastic job. So that's all I have time for today, really. It's been lovely being on here, and thank you all so much for listening and tuning in. If there's any questions that you have, please don't be shy. Send them away to exante or even send them away on my Instagram page. I'm actually going to go and get another cup of tea as mine's just gone a wee bit cold now. But thank you all very much and have a fantastic day. Bye.